Although the nervous system secretes neurotransmitters in lymphatic tissues, and lymphatic cells possess receptors for neurotransmitters, determining the effects of this communication is difficult. The complicating factors include the fact that there are different receptors for epinephrine and norepinephrine, the primary neurotransmitters of the sympathetic division. And while dendritic cells may possess alpha 1, alpha 2, beta 1, or beta 2 receptors, or a subset of these, lymphocytes almost exclusively express the beta 2 receptors. And so the same neurotransmitters may have differing effects on different lymphatic cells based on the receptor types that they express. Lymphatic cells can change the receptors which they express during, say, the course of an infection. The response of lymphatic cells to a neurotransmitter may vary based on their activational state at the time of the neurotransmitter release. A neurotransmitter may have varying effects on a receptor cell based on its concentration. Epinephrine may excite a given cell at a low concentration, but inhibit the same cell at a higher concentration. In addition, most, if not all, of the neurons of the autonomic nervous system can produce multiple neurotransmitters and can release them simultaneously. So, neuropeptide Y, ATP, opioids, the corticotropin releasing hormone, the vasoactive intestinal peptide, and nitric oxide can be released together and can thus have a co-stimulatory effect. So the response of the effector cell would be determined by its response to multiple neurotransmitters which can interact synergistically. The sympathetic neurons often use norepinephrine, ATP, and neuropeptide Y together, while parasympathetic neurons often use acetylcholine, ATP, and VIP together. Epinephrine and norepinephrine may also be present in the blood when released from the adrenal medulla during a fight-or-flight response, and some phagocytes are actually capable of synthesizing and releasing epinephrine as well. And so a receptor cell may be exposed to multiple signals simultaneously.